Friends, it's Carla, your online doctor, with today's Live in 5. Today is Thursday, April 8th. It is 5 p.m. So, we started talking on Tuesday about thyroid dysfunction. Okay, and we're going to talk more about that next week on how it relates to perimenopause, hormone balance, etc. But I brought up concerns about iodine status having to uh, how it relates to thyroid function. And here in the United States, I used to think that most people who had thyroid issues were at risk for thyroid for iodine deficiency. When in fact in the United States and in many countries, iodine deficiency really is extremely rare. Maybe in pregnant women because their requirements are higher, but most of us get plenty of iodine not only in our food, iodized salt. We get it in obviously seafood. Maybe vegans may have a little bit more of an issue as well, but for the most part, we're all doing pretty good. Okay, the excess iodine that we experience for many people also comes from personal care products and other things where other ingredients are found. Um, there's the concern that the extra thyroid can cause more triggers to your immune system. Okay, that it's not just a benign substance in your body, it actually causes your immune system to see proteins as foreign invaders. Okay, but the range where this happens is again much more narrow in some people. The research is finding that the excess iodine can be cleared out though using um, some pretty easy dietary changes, for example, or lifestyle changes, and it can allow for your thyroid to actually heal. The concern is, and the difficult part, is testing for iodine in the body. Okay, so what lab tests can we look at? Um, if you suspect that you have a thyroid disease and if you're concerned about iodine. The thyroid hormone panel is obviously the one, TSH, T3, T4. Obviously, you can have that done through and obviously through a medical professional or an endocrinologist, somebody who's watching you. Um, Iodine levels would seem obvious, right? But the testing is really bad when it comes to iodine. Um, it's just they actually test communities. They test the iodine coming out in the urine and they check for areas where people in the community are showing deficiency. So, how they can test it in wastewater, but they can't test it in people just at this point. I mean, after so many years of technology, still can't do it. Okay, so again, it's not just the food that we eat that affects our iodine levels. Cosmetics and other sources can cause your iodine levels to go up. Things are very, iodine is readily absorbed through the skin. So there's an app called Iodine Inventory. It's an app you can log in your food. It will give you an estimate of your approximate iodine intake from food. But you should be looking at the labels of your cosmetics and look for PVP, povidone iodine. It's a disinfectant that contains iodine. It's similar to what they would use in a hospital when they do betadine to clean off the skin. Again, you're not going for procedures day in and day out, so you don't have to worry about that type of exposure. But if it's in your skincare products, you are still absorbing it. So there are natural versions of things with iodine, obviously kelp, seaweed, plus iodine extracts in skincare. Like I said, if you have a chronic thyroid disease, you really need to look for hidden sources of iodine in your personal care products. Iodine has been added to salt for since 1924 or so in that range. So if you use home table salt, you're going to be getting iodine. Now, processed foods that are salty don't usually use that, it's more expensive. The sea salt, kosher salt, they tend to not be iodized. So if you're wanting salt in your food at home and you think your iodine is too high, opt for that as an option instead. Um, so If you have no thyroid disease, your iodine intake, they say that you can take up to 1,100 micrograms per day and be safe. That's not the recommended daily allowance. That's just somebody with no thyroid disease. If you're prone to thyroid disease, they're saying up to 200 micrograms per day and no more. Okay, the recommended daily allowance of iodine is 150 micrograms per day. So clearly, if you stay on the low end, you're okay. But my daughter, for example, took a supplement which had 75 micrograms of iodine in it. And when her thyroid was acting up, that was too much on top of food or whatever other intake she was taking in. So when we cut that down to once a week, she did fine. Now we're watch her on a regular basis, even though her thyroid is normal. Now we still know that she's prone to thyroid disease. Okay, for people who are taking medications, also, as you lower your overall iodine intake, your medication dosage may need to be adjusted. Okay, lab testing is required specifically. If you do this, you need to be following your TSH for trends. They say to follow them every 4 weeks. Most doctors will do about 6 weeks, but still, that's a close monitoring. The levels won't be stabilized at 4 weeks, but you can see if they're trending up or down or staying the same, so that if you need to make additional changes in your medication dose, along with your healthcare provider, you can do that. Okay, so it can be a little tricky. Not an easy one to follow. You need to be careful. Iodine deficiency is not what we thought it was. Okay, at least not what I thought it was. So stay tuned for next week because we're going to talk a little bit more about how estrogen and progesterone and thyroid hormone all interact, um, because they do, along with all your other hormones. So, on that note, I hope you're having an awesome day, and I will see you next Tuesday for another Live in 5.